Welcome back, everybody. Happy 2024. This is the first session for the new year. We have four to go for the year, and it's been pretty entertaining and interesting so far. So now I'm just rambling, so I'm going to get going. I'm off my game here. But anyway, welcome back. So this is the UK Healthcare Human Development Institute training collaboration, and we have a very familiar face presenting today, Christina Espinosa, who is our division director. And she has presented twice already, and now she's going to be presenting on a topic that is near and dear to my heart. I have a shameless plug in my background for the HDI CAT Center for Assistive Technology. So I'm just going to go ahead and turn it over to Christina and let her take it away.
Thank you, Nancy. Yep, I'll take it. Again, yeah, I'm Christina Espinosa. By way of visual description, I am a mid-career Hispanic woman with long brown hair, brown eyes, reading glasses. I'm wearing a taupe sweater today because it has gotten cold as we're finally entering January. And I meant to say beige. I don't really use the word taupe very often, but I'm also sitting in front of a virtual background of a UK office, and very much appreciate that Nancy is in front of a virtual background, plugging our HDI Center for Assistive Technology Services. And it's one that she and I both work at. So today we're going to talk about assistive technology, assistive technology in the workplace specifically. And I'm also going to give just a little bit of an overview of the resource of our regional assistive technology centers. And so in the past sessions of the series, we've together talked about kind of a high level overview of universal design and the idea that thoughtfully planning can remove barriers innately, right? And make spaces and environments and both virtual and built inherently more inclusive. Um, and so we've also talked and touched about how that idea of universal design and implementation of universal design can precede accommodations, right? So it can build in some of these features that mean that disability is removed from that environment and we don't have to provide some of these accommodations. But today we're going to move that discussion forward and talk a little bit more about reviewing assistive technology. And so this is where we enter in thinking more about how to accommodate individual personal needs with the provision of assistive technology. And more specifically, we'll talk a little bit about some workplace accommodations and areas to consider in workplace accommodation. All right, let's dig in. So this is just some of the fresh CDC data, disability rates across the US. This is from 2023. So across the country, there are currently over 61 million adults that have some type of disability. These are the different categories. So we've got mobility, cognition, independent living, hearing, vision, and self-care considerations, right? And in Kentucky, we are at an even higher percentage. So across the country, we're at 26% of the population. In Kentucky, we are at 37% of the population, or 1 in 3 adults that are experiencing disability. So that's over 1.3, well, it's 1.33 million folks here in Kentucky. And so as we look at those categories of different functional disabilities, of mobility, cognition, independent living, hearing, vision, and self-care, we here in Kentucky are significantly higher in every single category in terms of the percentage of adults that experience those disabilities. So just as a reiteration that we have a lot of work to do and a lot of people means that we have a lot of our workforce that is experiencing disability, right? So we have significantly more reason to make these considerations. So we're going to start with just defining assistive technology. Assistive technology is defined in different ways. You know, some of them are legislative, right? And so in that regard, AT is defined as technological tools that are used to access education, employment, recreation, or communication to live as independently as possible. Another definition is a device or aid that can help a person with a disability perform activities that might otherwise be difficult or not possible. So more broadly, more essentially, AT can be anything that you can make, buy, or change that will help any person with any disability to do anything more independently. So it's a pretty broad term. Different fields call it different things. So I just want to remove some of that confusion that adaptive tech, adaptive aids, auxiliary aids, rehab tech are all talking about the same thing, this idea of assistive technology. So this is the resource that we have referenced a little bit. Every state has a federally funded AT Act program. And this has been true since 1998, since the federal legislation. In Kentucky, that is called the CATS network, KATS network, and that is the Kentucky Assistive Technology Services Network. And the mission of this network and the requirements under the legislation are to provide assistive technology information, devices, and services and make them easily obtainable to any people with disability of any age and any disability. And in this piece of legislation, it's defined specifically as any item or piece of equipment, both low tech, high tech, or even no tech, that's used to improve or maintain independence in the home, at work, at school, and at play. So this website here is really wonderful. It's catsnet, KATSNET.org. And this is the site where you can find all of the contact information and locations for all of our regional assistive technology centers. So in Kentucky, we distribute this federal funding across 5 centers so that we can more effectively reach Kentuckians across our state without such significant travel, right? And the ways that we all provide these services are with these core functions. So we have a lending library, and so anybody can get on our inventory management system, which is this link available here on this slide. It's catsnet.at4all.com, and search the statewide inventory of devices. You can sort by different types of disability, by different categories of equipment, and you can search and identify different locations as well. What kinds of tools? So we here in Lexington at the HDI CAT Center have thousands of devices that are in our lending library that anybody can reserve and come pick up. And so the intent of the lending library is truly similar to a regular library, where we want people to be able to experience things, make informed purchasing decisions, try out a variety of different solutions for a particular need, and not have any cost associated with doing that, so that when they're ready to go purchase something, they know which one works best for them. We all also do different trainings at our center here in Lexington. We do every month a 4th Thursday ADA training. So we talk through all the different titles of the ADA and what protections the ADA provides. That's the Americans with Disabilities Act, what protections it provides at the individual level. Also, what businesses and what public resources are required to provide for individuals. So we walk through each title. We walk through different case study that might be current in the courts, so that we can kind of evaluate and see how our current social concerns and considerations are being applied and read under the law, right? We do product demonstrations, so folks can come in, with a crew of individuals from their life, or even just as themselves, and do demonstration of different solutions for different needs, right? So they might come in and say, having trouble with using a writing utensil. So we can pull out a bunch of different grips and different kinds of writing utensils that have different grips. And we could also pull out an iPad and show someone maybe how they could use the built-in accessibility features for speech to text or voice activation. We all also have a reutilization project, and that's what we call CARET. That's coordinating and assisting the reuse of assistive technology. So all of that equipment is also entered into our inventory management system, only it will be under a category called free. And so that is for anybody who needs it. We require, again, no proof of disability, no documentation from a doctor, no proof of insurance, no cost or fees, and really truly just want to be receiving donations of things, cleaning them and fixing them as we can, and distributing them back out to whomever needs it. We also all have a cabinet from the Kentucky Commission for the Deaf and Hard of Hearing. So this is intended for people who do qualify with hearing impairment. They can receive a free device from the commission every 3 years, and people can come to our centers just to see the different devices, check out the different screen sizes to determine which maybe captioning options might work best for them. The other thing they offer is a previous model iPhone or iPad. So a lot of folks go with that option instead of a physical phone or bed shaker or other such feature. I'm also wanted to remind anyone out there that I'm glad to take any questions or be stopped at any point if you have any questions. So feel free
Chris,
to, yeah, please,
yeah,
Sakia.
Christina. Yeah, this is just incredible. See that it's just you all do amazing work. So you were mentioning the Kentucky Commission for the Deaf and Hard of Hearing. Did you say that they could get a device, whatever that may be, to aid with their hearing free?
I
Is
did. And so
okay,
we have the cabinet of the devices that they provide for free. And so they have some vibrating alarms, bed shakers.
okay,
So like they'll do like a smoke alarm, visual alarm, a lot of different options of phones. And so some of the
okay,
phones will have built-in captioning, some will have a
okay,
lot louder decibel rating. And then they also offer a previous iPhone or iPad. So it's not
okay.
any device, but they have a
Well,
selection of
yeah,
devices. But yes,
yeah.
every 3 years they will provide people who qualify. So we have the application that we can give people,
Okay,
and people can
gotcha.
schedule a meeting to come in and see um, the equipment that they do offer. But yeah, it's a wonderful program. There's just so many different
Yeah,
wonderful programs out there. It's really difficult to kind of
yeah,
know how to
right.
access and understand what all the resources are. But one other great that reminds me, Takia, thanks for asking that, because one of the other amazing things on the catsnet.org website is a document on the front page called The Buck Starts Here, and it is a funding guide for assistive technology. And so it was just updated. We just released the most recent version of it about a month ago, I think. But it has broken down by disability type, both locally, regionally, statewide, and nationally, funding resources for assistive technology across the boards. And so that is something I definitely encourage all of you all as providers to know is there, to maybe even have a copy printed off of, and also to be sharing with patients and consumers and clients.
And you had also mentioned as far as like the lending library and the ruralization project, just either of those. Are things broken down, say for instance, if it's mobility or if it's lifting or if it's I don't know, how would one, I mean, you might have an idea of what you think you might need, but if you're not really familiar, I guess you would just read a description, do the items show up, and I can go on the link after we finish, but and look at that.
No,
But
please. I am actually pulling it up right now, so I can actually walk through that. That's a great use of this time, I think. So let me reshare my screen, and I can show you. So we've got, let's see, we minimize the show. Uh-oh, sorry.
that's
I
okay.
just got
That was pretty.
multiple things pulled up
Mhm.
here.
Oh,
Cat
right.
snaps.
I
Let's
totally
reload this.
understand.
Well, for some reason, I'm having trouble loading that right now.
Yeah.
Catsnet.e.
And I can go back to, I was just, that was more of a
Yeah,
curious
yeah.
question.
So there are several ways you might have to, it looks like.
Hmm.
But there are several ways you can search on there. So you can search by exactly that, by, a keyword. And then once you pull down the advanced search option, you'll have the opportunity to sort by category. So you could look at just that mobility equipment and kind of get an
Okay.
idea of what different types of mobility equipment
Okay.
are available. And so, yeah, there are several different ways that you can search on the site.
Okay. Great.
Okay, so let's see. So yeah, assistive technology benefits. There are many. This is why we love it so much. But one of our primary goals is truly for every person to increase the ways that they are able to participate in every activity of daily living that they possibly can. We count every one of those as a big win. Um, so whether that be figuring out a way for someone to participate in their own grooming and feeding themselves and preparing and dressing for work, anything that we can help someone do. Um, let's see. We also want to enhance independence, and that we want to happen across all different environments, right? Work being a very important one, but a lot of the technology that we have available to us now, one of the benefits of it is that it is more portable, right? We think about even just smartphones. These are things that we can carry across all of our life environments. And that we can utilize in all of our life environments that are also normalized in terms of everyone else has one in their hands or pockets as well, right? And so let's see. This is also improving social interaction. And so obviously that it benefits us in work as well, and improving communication. So thinking in terms of augmentative communication, and even just being able to use some of the technology that we have um, to communicate across all those environments as well. So we were talking just a little bit about categories. We think of these as some of the primary categories in terms of assistive technology that we consider in the workplace. So that augmentative communication, right? Making sure someone has the tool in place to be able to communicate is critical. Not only in education, which is where that begins, so that we can allow people the full opportunity to learn, but in work, clearly, in order to have that social piece, in order to have a more productive work completion, right? Environmental control systems can be really instrumental. So just allowing, we think about work most commonly in terms of being in an office. I think, I guess post COVID, a little bit less necessarily location based, but we think a lot of computer work and controlling systems. So our environmental control systems category is one that's grown so much in the last even just 5 years, but really 10 years, and our ability to control everything around us. And so I'm sure that we talked about that some in our universal design talk, but being able to change the lighting and to access the thermostat and to be able to look at a camera to open a door for someone or unlock it. These are all things that we can do now in many different ways, not having to necessarily physically be able to stand up and access those things. Seating and positioning is an important one in the workplace, right? So whether that be considering an ergonomic chair, we'll talk a little bit more about that, or whether it be access and ability to navigate a space from a wheelchair. Um, Aids for sensory impairment. So this is where we're talking about hearing impairment, vision impairment. We are all developing some level of these impairments too as we're aging. Our workforce is working longer into life, right? So we have more of an aging workforce that is maintaining engagement. And so these are all things that we need to be having in place for everybody. So bringing back again that universal design ideology, but recognizing that these are things at an individual level that we need to also address. Mobility devices, and then computer access. So again, this used to be computer hardware and software, but now I really want to focus on calling it computer access because we don't require all of this secondary software or this additional hardware now that is, maybe compatible with this system, but then needs to be upgraded. Or, there used to be a lot more considerations we would have to make in terms of how things would integrate. But now, through recognition of universal design and people with disability and just making things more inclusive, our operating system developers, primarily Mac and PC, Windows-based systems, have incorporated so many of these features into how we're engaging, how we're all able to engage with computers and computing. We'll talk a little bit more about that here in a minute too. So this slide just shows some more specific common assistive technology in the workplace. And so this slide is a list of things related to ergonomics, right? And so that's the positioning of our bodies so that we can best minimize fatigue and utilize, the correct positioning of where our bodies need to be in order to be more productive. And so some of the things that are really helpful to look at for people for a variety of reasons related to a variety of disability are things like having adjustable height desks, right? So some people need to sit stand. Some people need to approach something from a position where they're already in their own chair. And so having that adjustable height for a variety of needs, right? Wrist pads. So that's an important one to make sure the positioning of our arms and hands are in the correct place, and again minimize that fatigue and the pain that can become associated. I think we're seeing a lot less of things like carpal tunnel, right? A lot less because we're using more of these ergonomic features and considerations that are also functioning towards preventing some level of disability. We have a lot of options for alternative keyboards now for either ergonomic or other physical needs, right? But having our positioning in the correct place, but also keyboards for one-handed use or keyboards on screen for touch use, keyboards that can be switch activated, right? For scanning or whatever it might be, using a head mouse. So lots of different options there. We encourage the use of Bluetooth headsets. Cord-free access, right, is going to create less like secondary pulling and tripping hazards, but also to allow someone not to have to hold that phone in the crook of their neck anymore. I'm looking right now at Takia with a headset on, right? It just makes things a lot more physically comfortable and more possible for some folks. Lighting is really important, and that's one that we still do miss out quite a bit or quite often on, right? A lot of our office spaces have, you know, the fluorescent bulbs. So updating those to different bulb options can help with, you know, eye strain and fatigue with headaches, but also having those task lights, right? So having a desk light where we can focus the appropriate amount of light on a document that we might be reading, or, you know, making sure that even using when you're using computer screens, quite often having the blue light filtering glasses, or some of those other newer kinds of assistive devices or assistive technologies, even though they're not an actual technology, can really help with our ability to minimize fatigue and strain and headache. Having larger monitors, I mean, that the cost of those has come down so much, so more of us are able to do that. Having even multiple monitors, that's what I have set up in front of me right now. I know that with those of us that are working on computers, having multiple documents open, I mean, these things can really change the amount of both physical strain and visual strain that we're required to, or that occur over time, the time that we're required to work on those. Footrests. So another really simple and low cost solution. Lots of different footrests out there to help with our body positioning that can reduce, you know, fatigue on our legs and our hips, and then just allow for that 90-degree positioning that's encouraged as we're sitting at the computer for 6 to 8 hours a day at times. And then ergonomic chairs, right? So that includes considerations of a lumbar support. We want to have an adjustable lumbar support. We want to have a width and depth adjustment for our bodies, adjustable height, so that we can be seated at the correct height in relation to our monitors and our desk. And then also inclusive of armrests and upper back support. And then just considerations like I love to look at workstations and be able to consider how far things are for reaching, right? So the things that someone at a very customizable and individualized level are most commonly needing to use throughout their day, and making sure they are within a reasonable reach so they're not straining or creating additional fatigue. And then when we go back to thinking more about accessible features of the operating system, right? These are very common ways that we use this in the workplace. We think of dictation software, so we don't have to be typing everything. We can use a combination of typing and voice. You know, for people who have fine motor limitations or limitations with use of their hands and are able to type, or maybe have limited use of single fingers, we can engage both and fluidly, and so we can become even faster at dictation with the use of some of the software now, as our speech to text has gotten so much more reliable, is able to even incorporate appropriate punctuation and correct for context. It's amazing the growth that we've been experiencing in this area too. And then screen readers, right? So we can have screen readers that are just reading us paragraphs at a time. We can have our emails read aloud to us, if that's helpful, if we're having maybe eye fatigue. And then we can have full screen readers for people with no vision, where they can fully engage with every feature and every button on a computer and within any document. As we learn to create more accessible documents, that will be easier and easier, but that is another really amazing option for people in the workplace. And these are just really hard things for everyone to kind of keep up with the growth of. And they're, I mean, even myself included, right? So just to know that these are categories that are out there. There are places where you can go to get more information to make sure that you're fully utilizing the tools that are available to us, even as UK employees or healthcare employees, through our software and through our IT. And the other, you know, resources that are part of our work life. And then thinking even in terms of just simple magnifiers, right, that also built into the operating system, but maybe that also might be a simple handheld magnifier for someone who's needing to translate documents from paper to computer, or you know, there's a lot of different magnification tools, including full desktop screen magnifiers, right? Some folks are still using Braille, so having a Braille embosser could be another common AT in the workplace piece of equipment for those with low or no vision. So smart devices. Oh man, I could talk for days about smart devices. Just a quick image I pulled, but right, we have smart glasses now, and tablets, and smartphones, and smart screens, and ways that we can integrate all of them together. Smart watches, our basic computers, and then there are so many apps, apps that integrate across and can go from one of these devices to the next seamlessly now, that have features that are built in that can improve productivity and just possibility. Um, Setting timers and reminders. We can use live captions for FaceTime calls. That's now an option. So even if we're just in a noisy environment, we can be reading along to follow what the context is and what's being said on a call, right? You can even just open a note and live dictate a text version of a conversation, or use sound recognition to learn, detect, and identify unique sounds. So, say we're speaking even in a different language with somebody, or we're in a job where people are coming in, we're providing service to people with different languages. We can open a text version, let them speak, select it, and translate it into our native language. So, that's just a little bit of a tangent, but I love all of the ways that we can solve these problems now using assistive technology that's available to us. There are apps for task management, for sequencing of job duties for those who might have some issues with remembering what order to get things done in. Depending on the employer and what software they use, there are typically complementary apps that would offer access through an employer account, that can be used on other devices, not just your primary computer. One of my favorite for vision impairment is called Seeing AI. So that's a really great free app where you can detect faces. It can learn faces and it can tell you who's approaching you. It may be in an AirPod, right? So it's not even an out loud thing, and telling you what scenes you're seeing and tell you what currency there is and translate optical character recognition, translate documents into audio, right? So there's just so much out there that is considered AT in those areas. So I have a slide here for some of the built-in accessibility features that are included in Windows. I know most of us at UK use Windows-based PCs. So this is a list of some of those features, and then a link here that I would definitely encourage you all to take some time and go to. But it does walk through the features that are now available within Windows that are built into the operating system. So things we can all turn on if they're going to benefit us, and things that if we know about, we can suggest for others in our lives as well, our coworkers and other people. And then I also have one of those slides for the built-in accessibility features that are available in Mac and on Mac computers. And so similarly, this link down here will walk through. They both call the features a little bit different things, but they have a lot of similar crossover features, like text to speech, zoom and high contrast, sticky keys for fewer keystrokes, speech to text and voice control, word completion, word prediction, sentence prediction, and many, many more. So these are free, these are built in. And yeah, I just wanted to open up to any other questions and give you the information here. So this is our Regional Assistive Technology Center. It's another of our HDI projects here in Lexington. So for any folks who are interested in coming by, welcome to do so anytime. Please do check out the inventory management system and create a free account there. Share it with all the people in your life that would benefit from it too. We'll go ahead and stop the share and see if there are any other questions.
No,
All
always a
right.
lot of good information. Yeah. So thank you.
Thank you. It's great to
Thank
see
you,
you.
Christina.
Yeah, Christina, always. And Happy New Year to everybody. I didn't get to say that
Happy
at the
New
beginning.
Year.
Happy New
Can
Year.
still say that. Yeah.
Yeah, we can.
Yeah.
And
Yeah,
I'll go ahead and
absolutely.
send out the link to this recording afterwards.
Okay. Great.
Well, have a great rest of the day, everyone.
Yes.
Thank you. You too.
Enjoy.
Thanks so much.
Bye,
Bye-bye.
everybody.
Bye.
Bye-bye.